All right, welcome back to another episode of Innovators of Health. I am sitting here with my friend Dr. Emily Park from Scottsdale, Arizona. Welcome to our show.
Thank you, J-Dub. It's an honor to be on your show with you guys.
Well, thank you. It's an honor to have you. So I'm going to jump right into your origin story because
Sure.
um, it's important to learn about who you are and what you do. So let's
Yeah.
what the research I've done and what you've told me is you started at the Cleveland Clinic in anesthesiology, specifically pediatric, and then you were also at Children's Hospital. So you've seen traditional medicine in the hospital setting. Um, Talk to us a little bit about how did you go from there into taking that step into functional medicine?
Yeah. So you're absolutely right. I went to, traditional medical school, internship, residency, fellowship, moved to Phoenix, Arizona, started working as an anesthesiologist. And to make a very long story short, I, started experiencing burnout. The hours were really high, 80 plus hour work week sometimes, nights, weekend holidays. My longest on call session was 32 hours in a row. Which at first, when you're new, out of training, everything's very exciting and, you're really enjoying everything. But then after a while, the effects of long term stress just started to kind of take effects on me and it wasn't much fun anymore. And so I didn't know why I was feeling the way I was. I started having, trouble sleeping and I was having some like heart palpitations and some, GI symptoms and whatnot. And I was just a healthy person in my 30s at the time and thought, why are these symptoms happening? So of course I go to a regular, primary care doctor and they didn't really have many answers for me, right? They're like, oh, okay, well, you can't sleep. Here's a prescription, for that. Here's, your stomach hurts you. Here's a prescription for that. And I walked out of there thinking like, this is crazy. Like, I'm really healthy. Like, I have never had an issue. Like, why, like, how come I'm like, I wanted to know why it was happening, right?
Hmm.
And I just didn't get those answers. One of my colleagues at the time doing anesthesia, she had said had really good experience with acupuncture and sleeping well. And at that point, I was like, oh my gosh, I'll do anything to get like good quality sleep. So I started going to acupuncture myself. Of course, acupuncture and Chinese herbs did work really well for me for sleep and then for my stomach symptoms and for stress management. And so that kind of shot me down all of the other pathways that are possible in medicine. And the acupuncture was actually the first thing I got trained in. So I dropped my anesthesia hours to be part time. So I was working 50%. So I was still working like 35 ish or so hours a week, but it was enough time to get myself trained in these other areas of medicine. So acupuncture was the first thing I took. I took the medical physician acupuncture training. And
Hmm.
during that, is where I learned about integrative and functional medicine. It was the first time I even heard, of those fields of medicine and kind of became interested and learned about the Institute for Functional Medicine, got got certified, did all the training, through them. And then here I am. And so about 10 years ago, 10 and a half years ago now, I broke completely away from anesthesia and opened up my own wellness practice.
Oh, that's awesome. Yeah, you've had quite a bit of a journey, and there's probably other practitioners. There's so many of them having that same conversation in their minds as to how they, how they can do something similar. Just because of the way healthcare is moving. So let me get this straight. So in functional medicine, the goal is to treat root causes, right, rather than symptoms. Correct?
Exactly. So, yes. So, functional medicine is exactly like the key term that I say. It's all about finding and treating the root causes. So, the reason why symptoms and disease are happening, right? Instead of the traditional side, which is what I described earlier, which is, hey, you have a symptom, here's a prescription. And
Yep.
in my world, it's like, well, what are the reasons these symptoms are going on? Oh, you're not sleeping. Okay. What are your sleep hygiene habits? Like,
Mm.
is your, face in your phone until midnight and then you're like, oh, I can't fall asleep, or what are you, eating a meal 3 minutes before you're trying to go to bed? Like what are those sleep habits like? What are your stress levels like? What are your activity levels like? What's your exposure to sunlight like? And so on and so forth. What's the room temperature? Is it dark? Is it quiet? I mean, all these things, these are all questions like when you would want to ask when someone's not, sleeping well, is there a possibility sleep apnea is going on? Is there snoring? And so on and so forth.
Yeah.
So really diving into like why is that patient experiencing that symptom, because you want to figure all those out when and if at all possible, right? Because even if you give a prescription for something, it you haven't really fixed like the reason why it's happening, so other things are likely to pop up, right?
Yeah. So you said a different, you said multiple things. And so when you're evaluating a patient, uh, what are some of the first things you look for, based on kind of some of the things you just talked about?
Yeah, so we have huge roots in lifestyle and functional medicine. So deep dives into nutrition, sleep, exercise and movement, stress management, toxin reduction. Those five things are the foundations to health. And for most people, it's about 80% or so of what creates health. And then
Hmm.
we say the other 20% or so is what's going on in your own body's biochemistry. So that's where we do a huge deep dive in the laboratory data to figure out what is your unique biochemistry, what's going on with like all of your hormones, what's going on with your blood counts, your electrolytes, your kidney and liver function, what's going on with your lipids, your blood sugar, e- all the nutrients, like, and so on and so forth. Huge list of labs that we like to look at in the blood. And then we also have access to and training in all kinds of other laboratory testing. So let's say we want to do a deep dive into toxins, looking at environmental toxin exposure, mold toxin exposure, heavy metals exposure. Or do we want to look at food sensitivity testing? Do we need to look at a stool study or a breath test or an organic acids test, and so on and so forth? There's so many testing options that we can use to take deep dives, and we of course personalize this to each patient. There's nothing cookie cutter in the practice. It's the N of one, right? So it's a very
Yeah.
highly personalized type of medicine.
And what's unique to you than other maybe specialists are that you have to be on the edge and the cutting edge of so many different modalities because of this holistic view and approach that you're taking to medicine. Given that you're giving a very personalized medical approach, right? And treatment approach. So how do inflammation, mitochondrial health, and cellular energy play into many of the chronic issues your patients experience?
They play into all of the chronic issues, right? I mean, that's how it happens. Yeah, so I have a lot of patients with autoimmune diseases, for example, and autoimmune diseases of all kinds. It could be Hashimoto's thyroiditis, it could be lupus, it could be multiple sclerosis, and rheumatoid arthritis, celiac disease, ulcerative colitis. It could be, any. I have a lot of autoimmune disease patients in the practice, right? And those are all inflammatory conditions. They're
Yeah.
your body's immune system, attacking, that person. So I've got a lot of autoimmunity. I also have, patients with unsolved mysteries from regular medicine, right? Like they have symptoms or diseases going on, and the reasons why the root causes have not been figured out, or that patient is like, no, I don't want to take steroids, for example, or no, I don't
Mhm.
want to have a surgery if I don't have to. And so they're, seeking us out for alternatives. And then, we've got all of the standard top causes of morbidity and mortality, right? So a lot of patients with cardiovascular disease. So it could be as simple as high blood pressure, but also other patients with, heart attacks in their past, open bypass surgeries, in their past. And of course, metabolic issues. So, as simple as insulin resistance, but also prediabetes, type 2 diabetes, and so on. And then, of course, all the hormones, right? Adrenal, thyroid, and male and female hormones. So, issues with all of those. And then nutrients, like I was saying, is we take a huge deep dive into each individual's nutrient status as well. So I treat pretty much everything across the board, which is why red light therapy has it's been awesome in the practice, and I have so many great patient examples of starting to use the red light and seeing really good benefit.
Well, before we start diving into that direction, because I'm excited to talk about that, um, when did you first start exploring red light therapy in your practice, and what initially caught your attention um, about it from a functional medicine standpoint?
Yeah. I mean, so obviously, red light therapy or photobiomodulation has been around for a long time. And I've known about it for a long time. But
Yeah.
in years past, I was dissatisfied, let's say, with the options that I knew about, for red light
Mhm.
therapy. Maybe untrusting's the word, or it's like, is this really the red light that the company says it is, and how does it work, and what's the research like on it, and all of that. So it's kind of always been in the background. But then this past summer, I was actually talking to Nikki Goyle, right? Dr. Goyle's wife, and
Yeah.
her and I are friends, and we were talking about sleep, and she just mentioned she thought using your guys' red light had like improved her sleep, and I was like, "Ooh, okay, well, I'm perimenopausal, like sleep is a thing."
Yeah.
So I'm like, and again, it's diving into the research, which we can get to in a minute. Like, there's so many good uses of it, and it's like, it's how can it's not it, there's really no downside to it. And so that's July, is when I bought my first red light, and I got the 300 with the stand. And I got the smaller one, the 62. But it's funny, I almost rarely use the 60. I pretty much use the 300 every single evening.
Mhm.
Very consistent, with doing that. And then I also over the summer had some issues with low back pain and spasms, which was a new phenomenon. And between those, for me personally, it helped me with the low back, and it helped me with sleep. Those are the first two things that like grabbed me personally. And I always try things out first before I start recommending them, for
Yeah.
patients. And so myself and my husband started, using the red light therapy pretty regularly.
So what were some of the first things you experienced? Was it sleep? Was that the first?
Yeah,
What did you
sleep
know?
was pretty obvious, and I track. I wear an Oura Ring, to track my sleep. And so, statistically, I was getting a little bit more REM sleep and deep sleep, and my the amount of time I was awake, so my sleep disturbances, went down. By the way, this is me using it in the evening for 10 minutes. 5 minutes on the front and 5 minutes on the back. Like, I'm doing a
Okay.
very low key, simple protocol. And, I started getting results with that.
It's like anybody can do that. 10 minutes is it's so it's 10 minutes goes by like this.
Yeah,
When
it's
you do
so
stuff.
fast. And then to be honest, when you guys, we just released the cap. I
Mhm.
was like, okay, great. So now when I do my 10 minutes, I put the cap on,
Okay.
and I put 5 minutes back, and I have the cap on too. Which that was kind of, it was pretty cool when obviously the cap, and we can talk about all the specifics whenever you're ready, but like it
Yeah.
does increase blood flow. And so almost immediately, the first few times I used it afterwards, I was like, oh, I have like almost like a minor headache. Not to a point where I was like, oh, I need to treat it, but that that's a clue. It's like, oh, like obviously it increased blood flow, right? When there's more blood flow going to your head. So to me, that's a sign, like an objective sign, that
Mhm.
it doing something. And that kind of wore off, after using it a few times. Like, I think, my body got used to it. And now, like I said, I won't do my evening red light session without the cap on.
Oh, I love hearing that. So when you introduce Redvive to a patient for the first time, how do you explain what it's actually doing inside their body? And when does this conversation come up with them?
Yeah. I mean, it comes up a lot, frankly, because, when you talk about photobiomodulation and what what are the possible benefits, like if you think about it in broad terms. So that's why I like to explain it to patients in broad terms. It helps the mitochondria work
Yeah.
better. And
Mhm.
it's anti-inflammatory, and essentially helps the immune system work better. So those are like basic broad things of like that of what it does. Then if you start doing deep dives into the research, it's like, oh, okay, there's really good data on pain management, there's great data on skin conditions, there's great data on cardiovascular disease risk,
Mhm.
and
Yep.
so on. And obviously, like recovery from exercise. And I mean, the data is huge, and it's a very wide body of research that's been done. And so it's one of those things that almost anyone could have some potential benefit from.
Are there any specific conditions that make you talk about it more than others? So I'm a new patient. I come to see you. At what point do you introduce that modality to me? And do you start talking
Um,
about it?
It's, by the way, like in my office, where at the room I see patients in the most, I have a Redvive 300 and a cap. So like people are seeing it. And so sometimes it'll be like, oh, I was thinking about one, and they will spark the conversation before I
Oh,
can.
okay.
Yeah. But I'm usually having patients focus more on at the beginning, like the very first visit they come in, we've got to get their lifestyle factors straightened away. And we've got to see
Hmm.
what's going on in their labs. But it's not too long after that, maybe a visit or two later, where, some of these other conversations come up where it's like, oh, I'm still having, you know, back pain, or I'm still having, hip pain, or I'm still, doing all the things for sleep hygiene and it's still not going great because I know I'm not able to get outside to sunlight. So like, what can we do? So pain and sleep, I think are honestly my top 2 reasons why, I start talking about the red light, but then like right behind that is recovery. So I have some, elite athletes,
Yep.
and, high performers in the practice. And so that's another, great reason, to stick the red light on. And then, with the cap is relatively new, right? So that adds a whole other tier of cool stuff. Obviously, hair loss, right, is a thing, that it helps with, but it's brain health, right? It's cognitive,
Yeah.
improvement, and so those are like the top reasons. And then what's interesting too is if you think about it, you not that it's not that mitochondrial health doesn't have symptoms. It has a wide variety of symptoms, and that can have many different root causes. So sometimes, like when we do red light therapy, it'll take, if you're doing it for, let's say, cardiovascular disease, right?
Hmm.
It's it's not like next week you're gonna be like, oh, my coronary artery disease is better or something like that. Like that's not how it right. It's not gonna work that way. But if someone's using the red light therapy, over a longer period of time, 2 months, 3 months, and, you start to see blood pressures float down, then that's an objective sign.
Interesting. So you just said pain and sleep are the primary, and then recovery. So,
Mhm.
um, so if I were a new patient coming into your clinic and we talked about any of those three things, especially around pain and sleep, those are going to
Yeah.
be the points where you're going to start to talk about this and the benefits there. Now, is this something you recommend after? Is it the testing you do with the patient, or is it during treatment plans? Like, what part of you know, the treatment or journey of the patient are they getting introduced to it?
Yeah, it honestly varies tremendously. It just depends on how the patient visit goes and flows and what they're interested in and what, I think they may benefit from. Obviously it's something pretty much everyone can benefit from, but at the first visit or two, there's a lot of other stuff going on, right? Because I'm doing lifestyle medicine, right? So it's
Yeah.
I also cognizant of not trying to overwhelm patients with too much stuff,
Right.
at the very beginning. But like it's not too far after that these other conversations, kind of start to come up. And like I said, we've got, the red lights there, so it's sitting on the bedside table as well, like, a brochure. So patients know that it's something that I recommend.
So earlier you said that you've been exposed to photobiomodulation, you've known about red light therapy. Many of your patients, especially the popularity of it, have also been exposed to red light therapy somewhere, or from a
Yep.
friend or something like that. I'm sure you get this question in terms of, there's skeptics out there, or also people wondering, yeah, you know what, I can get this. I can get a panel or something on Amazon, or I've actually, I got this mask at home and stuff. Like, why do I need that? That you're talking to me about this. So, what do you explain to them? How do you answer
Yeah,
those
it's
questions?
it's actually super easy. Um, Redvive is an FDA approved class 2 medical device. So it's actually been tested, and you're getting what the product actually says. So the way I explain that to patients is kind of like supplements, right? It's like you want them to be third party quality tested because you could get a bottle of whatever. Let's
Yeah.
say this says vitamin D 5,000, and if it's not third party quality tested, these could be salt pills or sugar pills, or it could
Hmm.
have 1,000 of vitamin D in it, or whatever
Mm,
else in it. And I think it's the same in the red light industry, right? Like all red lights are not equal, right? It doesn't mean it does, the specific wavelengths, right? Like photobiomodulation has specific wavelengths. Like the term goes from like 600 all the way up to an 1100 nanometers of light. And so if you don't know what you're getting, to me it's like it's a waste of money. So that's one thing I say. The other thing is that there's a 60-day money back guarantee. If buy it, if you don't like it, the company will return it. And then the
Yeah.
warranty that goes along with it too. 1 year warranty, right? Um,
Two.
and 2 years, sorry, 2 years. And so that's like Redvive really stands behind their products, and that was my like experience with your guys' customer service, right? My personal experience right from the start. Like it's just a lot of support. And then also too, what I tell patients if they're not, sure if they want to buy a light or which one they should buy, that, you guys also have clinical support so they can get on the phone with someone actually get on the phone with someone from Redvive and talk over their exact situation and, help them decide.
Yeah. No, all of that is true. And we try to take a Amazon customer service approach. I mean, we want to make sure that everyone is satisfied. So, if somebody's having issues 2 years later, and they come to us, we're going to take care of them. Our objective is to make sure that people use this light, they feel better every day, they recover, and they live their best lives. So, and we're going to stand by that. Um, every bit of the way. So, so what kind of changes have you seen in patients once they start using this? Let's talk about some of the um, patient case studies.
Yeah, yeah. Um, one girl is popping into my mind. She is a young mom in her early 30s. And she, got diagnosed with multiple different autoimmune diseases and was having,
Hmm.
significant pain and actually, muscle weakness and I mean, really significant symptoms. And,
Hmm.
you know, really high dose steroids and doctors wanted to put her on all these other hardcore medications and whatnot, and of course also in the background doing all my functional medicine stuff, right? Like we're doing all the blood work and the stool studies and like guts and health and nutrition and sleep and exercise, all the stuff, right? We're doing all these other things too. But I added red light therapy in for her pretty early on because I was like, ooh, like this person is so symptomatic, like you need help now. Like we're going to work on all this other stuff that's going to take a while, but like let's get the red light ordered for you. And she uses it every single day. I've had I think 3 follow-up visits with her now, and it's like very much incorporated into her daily relief essentially. So that and I've had other successes with pain management, even just minor things like at people recovering. I have another patient, she's in her 60s. She was recovering from hip replacement surgery, using the red light pretty regularly with that. So just a wide variety of symptoms. I've got another two males. One's in the 50s, one's in the 60s. That they're using it for cardiovascular disease, right? And so they've had significant coronary artery disease. One of them is a kind of a super athlete type of a guy, so he's also getting the benefit of recovery. But it's such an easy thing to do, right? It's like we were just talking about, it's 10 minutes. And so what I tell patients is, hey guys, it's anywhere from 5 to 15 minutes, one
Hmm.
to two times a day. And that's like the typical prescription, for red light therapy. And it's so easy to get in. It's not you don't have to do it for super long to get the benefit. As a matter of fact, I also warn patients, I'm like, hey, this is kind of like exercise. Too much? It's not, you don't want to do an hour of red light therapy session necessarily, right? Like maybe 10 minutes or 15 minutes is good,
Hmm.
right? You can
Yeah,
overdo it too. But it's such an easy thing for people to get into their habits and their routine.
that's awesome. I want to know what's a case study that blew you away because you see so many patients, you have such a loyal, you know, following of patients that'll just do what you say, and but of the people that you've introduced us to, can you think of something or someone who they started to use it? Maybe you were skeptical in the sense, and when I say skeptical, that this could work, but you haven't seen it yet, and you were
Yeah.
just blown away by like, oh my goodness, I can't believe that it worked on this patient. And now that opened up another set of doors, for you, at least in your mind, for who else you could
Yeah.
be treating. So do you have anything like that?
I mean, honestly, it's hard to pick one because, like, I've prescribed so many red lights now, and knock on
Yeah.
wood, everyone has loved it, right? It's not like, it's not like, oh, I don't, everyone's using it. You know what I mean?
Yeah.
Everyone's loving it. It the way I like to think about it, it's one of those things where you just keep doing it because even if you like, you just feel better.
Hmm.
Even if you can't describe, like, even if you didn't have pain or sleep,
Yeah.
issues, you're just doing it for general health. It's one of those things that you keep coming back to because instinctively you're like, it feels better. You know, what's really cool is when personally when I do my red light sessions, we have dogs, right? And so there's I would say 9 out of 10 times one of the dogs will they like, oh, the red light's on, they'll come right in there with me. They know it's good for them.
Yeah. Yeah. Oh, yeah.
Yeah, which is so cool to me.
No, I've had friends use it on their horses, and they feel so much
Mm,
better, and they just healed better because of it, and they're race horses. So we know that it
yeah,
works well for equine. It works well for cats and animals. I mean, the way Rahul says is that if a living organism, if you have mitochondria, it's going to work for you.
totally,
So it's one of
totally,
those things
totally.
that it doesn't. There is no one that it cannot help. And so with that, I've heard on another, functional medicine doctor named Dr. Logan. He he was telling us that one of his patients experienced the benefits of using this for endometriosis, and something that that was one of his big ahas. Like, wow, I cannot believe that it worked for this, and it really set him down
Yeah,
another path for that. So that's why I was asking. I mean, there are certain conditions. You mentioned autoimmune that you don't really think about that. Would this really work for that? Yes, it's like a Swiss Army knife for health. We've got dental practices, we have podiatry
yeah,
practices, other regen doctors that are using it for different things. But you're unique in that way because they're seeing teeth, they're seeing feet, they're seeing
I'm
very
eating.
specific,
Yeah,
and you're seeing
yeah,
everything,
yeah.
and so I think it's very unique that at the position that you're in because you're really able to use this modality in so many different ways. So um, cardiovascular, you said pain. Who else comes to mind that just that has been introduced to this and they said, "Wow, thank you so much."
I have a gentleman who is in his late 40s who has a skin condition that is still kind of undiagnosed. Went to at least 5 different dermatologists, got told many different things, many different prescriptions for things. This He chose not to take the oral steroids. A lot of my patients, like, they kinda know, like, okay, even if it
Mhm.
helps in the short term, that's not a long-term answer, right? Like,
Yeah.
it's gonna come back and it's not good for you long term. But lots of topicals, lots of things. Started using, the Redvive, 300 red light, twice a day, and not very long. He told me he wasn't doing it more than 10 minutes twice a day. And it took, I think he told me it took about 3 weeks, just under like 2.5 to 3 weeks for his like skin condition to start like completely turning around, which is kind of cool, right? That's a pretty short period of time.
Yeah.
For an unsolved mystery and out in the traditional world, for to get a nice turnaround. And so there's so many cool examples of that stuff, in the practice. And like I said, when patients come back for follow-up visits, they're already using the red light. Oh yeah, I love it. Like I won't like they just don't miss it. They won't miss a session.
Do you know what that condition was? What's it called?
Um
Or is it
okay, so this person was told it was Grover's disease.
okay.
Um they were told it could be a folliculitis. They were told maybe a weird form of eczema. They were told maybe it's fungal. I mean, it was like, yeah. It was a big list and 5 different dermatologists. Anyway, so, it just ended like, we obviously were in the background doing some things with, gut healing, and there's obviously a huge gut skin connection too. Um, but, to be honest, like, we had already been doing some of that stuff, and it was kind of who knows if it was what the timing was like, but it was like, he was pretty clear, like, "Hey, I started using this thing," and it took about 2.5, 3 weeks for, the, skin condition to turn around, and knock on wood, that was a couple months ago, that he had reported it's pretty much gone, and we've stayed that way. So it could so, it this his skin condition was probably in this, autoimmune inflammatory condition,
Mhm.
or a diagnosis if we think about why the red light therapy might have worked for him, right? Because if he had an infection, that's not gonna help, right?
Right.
You know what I'm saying? You have to treat the microbe, the infection, or it will help only partially. So that was a really cool, kind of, we still don't have like who knows what the actual diagnosis actually is, but it doesn't matter because the patient got better.
Yeah. How does this help women in perimenopause?
Oh my gosh. Speaking from experience personally, and my practice is full of perimenopausal women. I've got a lot of women, 30s, 40s, 50s. Um, the biggest help is sleep, right? Because that starts to go sideways for us. Many years before menopause actually hits for a lot of us. It's just not as good, especially second half of the cycle. When progesterone starts dropping, and then of course we're doing all the things. We're doing hormone replacement therapy also, right?
Mhm.
But the red light to me is icing on the cake for those conditions. It just, like I said, I have my own personal sleep data that showed that I'm getting more deep sleep and REM sleep, and it's also what I said earlier, which is this vague feeling of like I don't know, I just feel better. Not very scientific, but very true. Like if you just and that's what we care about is making patients feel better. But I think it's pretty helpful for sleep and recovery
Mhm.
for those, menopausal women. Because again, I have a lot of, healthy patients, and healthy meaning patients, doing a lot of activities, and they're, doing high end workouts, and they may be competing, they may be running a marathon or doing, an Ironman or something like that. And the red light's really helpful for them.
Oh, that's awesome. Th- I can see how that would help a lot of people, especially with sleep. We use it at home right before bedtime as well. And we've got the kids also as part of that routine. And, when you put that ambient lighting on, and yes, even if when you are looking at the phone or you're watching something, it's pretty amazing to see how it doesn't interfere with your sleep, and you can actually fall asleep with it. I mean, the amount of times I've fallen asleep with the red light on, because I like to put it in the on position instead of the timer, and it just
Yeah.
stays on. Then I just wake up later on. Okay, I need to shut this thing off. But
Yeah. Yeah.
definitely helps. There's
You know
there's go ahead.
Oh, I was gonna say the 60, the small desktop one, that's kinda actually where it
Yeah.
lives in my house. It actually lives on my bathroom vanity, because 'cause I'll, like, getting ready for bed, like, I will sometimes have it on as, like, ambient, especially if I've been kept up late. So let's say there was, like, a late dinner or a late something, and I was, like, exposed to bright lights too late for my little sensitive perimenopausal brain, it actually does help. It totally helps, yeah.
It does. So what would you say to skeptics out there? I mean, there's a lot of practitioners out there that they may be shaking their head and say, yeah, I've heard of it or I do use it and stuff, but they're not really integrating it into their practices the way you are. What would you say to them,
I
about
would say,
integrating something like
like,
this?
just try it. Like, you have nothing to lose. Just try it yourself. That's, how I started with it, right? It's like, I let me get it and work with it and see what my benefits are for myself and my family. And then, then it's easy to recommend to patients because I'm actually doing it. You know what I mean? It's March now, and I've been doing it, every day since July, mid July when I got it. You know what I'm saying? So it's just try it out yourself. And like you can't go wrong, right, with the 60-day money back guarantee and
Right.
the 2-year warranty. So it's just so easy to try. Why not try it?
No, it's a great answer. When you think about the future of functional medicine, where do you see um, therapies like photobiomodulation fitting in?
Yeah, I think it's something every single patient could benefit from, especially the world we live in today, right? Like our stress levels are all higher. Um, you know, Even trying to get enough good quality sleep, like a lot of us, try really hard to do that. Stuff comes up. I think it's really great for recovery. It's because it helps the mitochondria work better and it helps with the inflammatory pathways. It's also for me, it's also prevention, right? It's part of being preventative, which is a huge part of functional medicine as well. So, I would be super happy if every patient had one and would actually do it consistently.
So, um, what is something I haven't asked you yet?
I don't know. What haven't you asked me? um,
um, no, I
yeah,
want
thank
you.
you.
I really, I want you to have. I want you to say whatever it is that that they're going to see. Patients are going to hear this. Other practitioners are going to hear this,
Yeah.
and you have a message. What you've experienced in your journey is very special. Um, People should hear it, and so. Um, I want that opportunity to shine through is what's something that hasn't been said yet, something that you say to others. Like if I put a billboard up and put from Dr. Emily Park, and there's a quote that you want somebody to live by and think about as it pertains to maybe your legacy, what would that be?
Yeah, I would say when it comes to your health, health is wealth. And that's how I view it. It's like all the foundational things, eat good food, right? Get your exercise and movement in. Make sure you're trying to get good quality sleep. Watch your stress reduction and make sure you're not taking in toxins, right? So do what you can to take really good care of yourself because if you don't have your health, nothing else matters.
That's beautiful. It's great. Well, it was awesome to have you. Thank you so much for your time today. And we'll definitely have you back on as you continued this journey because I know there's going to be a lot more to talk about, a lot more to tell. And, people are just scratching the surface, at least those who want to watch this, just, getting to know you. But yeah, I think you're going to create a big impact. So, excited to watch you do it.
Thank you so much. Thanks for having me on.
Yeah, absolutely. So